Hello, I'm John Potter. For over 20 years, I've been talking with Northern Nevadans. I've helped explain complex issues that affect you directly. Today, I'm here to help you understand one of the most complicated issues of our time, healthcare.
And I'm Alex Sampson. I'm the owner of Health Benefits Associates. I work with a team of professionals who help Northern Nevadans choose health insurance and Medicare plans.
Alex and I will be your tour guides today. We're going to introduce some of the doctors here in Northern Nevada. Let me tell you, there are so many changes in healthcare, it is hard to keep up. Today, we're going to meet a few doctors who are leading the way in their specialties.
That's right. On today's show, we will interview some of Northern Nevada's top doctors, check out Reno's newest hospital, and give you insight into the most state-of-the-art local emergency room.
I've teamed up with Alex and Health Benefits Associates. The health insurance plans that Alex and his team offers are the keys to being able to access these doctors. When I meet with my doctor, I want the focus to be on me and my health. The team at Health Benefits Associates takes care of the rest and makes sure the insurance piece is taken care of. First up, I'd like to introduce you to Dr. Catherine Pinkston, a board-certified family medicine physician who's been practicing in Reno for several years. She specializes in preventive health with an emphasis on nutrition and works with Pinnacle Medical Group. Dr. Pinkston.
Hi, good to see you.
So doctor, nice place. What is this?
This is Pinnacle Medical Group, and this is one of our 4 locations where we see our patients.
And this is the one on Charlins Avenue.
Correct.
Besides people coming for like a yearly medical visit, what can you do here?
Well, this is a primary care office, so we provide comprehensive care, and that includes not only annual visits, but also visits for urgent issues and visits where we take care of chronic health conditions.
Doctor, I want to ask you about heart issues. Are you able to detect a lot of heart issues that people may have here at this office?
Certainly, we can absolutely perform some initial heart testing, including EKGs, and we also offer cardiac echoes as well. And so if any of that's abnormal, or if the patient's having any concerning symptoms, we can get them in with a cardiologist.
What is the most frequent heart issue that you see here in this office?
I would say heart issues related to high blood pressure, so congestive heart failure or sometimes heart attack.
What if they need like further examination of this heart issue? What do you do?
Refer to cardiology.
Cardiology. Do you have people in mind that you refer these people to?
Well, I like referring people to Dr. Desai for cardiology, as well as Northern Nevada.
Tell us about Dr. Desai.
Well, Dr. Desai's been a cardiologist here in Reno for a while now, and he's taken care of quite a few of my patients, and my patients like him a lot.
How do you think we are in terms of cardiology care in Northern Nevada?
I think we have good cardiology care here in Northern Nevada. I think access is always a little bit of an issue, so anytime I need to get a heart patient in for an issue pretty quickly, Dr. Desai is one of those people I can get them in with.
What kind of time frame are we looking at here? If you refer somebody to a cardiologist, how soon can that cardiologist see these people?
Well, sometimes it's an urgent issue and I need them to be seen within the week, and sometimes it's more non-urgent and they can wait a couple months to be seen.
You do good work here. Do you like it?
I do like it. I do have a fair number of patients with heart problems, and there's definitely some easy lifestyle steps that people can take to help improve their heart health. Most of those include diet, exercise, and not smoking. One thing a lot of people don't know about nutrition that I frequently look into in primary care is vitamin D levels. Almost everybody's deficient in vitamin D unless they're outside all the time in the sun. And so because that's such an important vitamin for calcium absorption, bone health, muscle health, I usually check levels for patients and get them on a supplement if needed. Yeah, so I think we hear a lot about fad diets right now, and generally speaking, if you're eliminating an entire food group from your diet, that's typically not sustainable over time. I think it's important to eat everything in moderation. And I would say one of the healthiest diets you can follow would be the Mediterranean diet. And that's because it focuses on fresh fruits, fresh vegetables. It's low in, red meats, saturated fats, and high in whole grains and healthy fats. I would say my favorite piece of advice for healthy living is start small. A lot of patients think that they need to do a complete overhaul of their entire diet, their entire exercise regimen, but really, if you can just start by adding an apple and a vegetable per day and a 10-minute walk, that's going to do wonders for you. I love working at Pinnacle Medical Group because I have the flexibility to individualize patient care. I also just really like my colleagues and the people that I work with. I think we have a really dedicated team of primary care providers that are all really excellent at what they do, and we also have very dedicated staff, including our medical assistants and front desk staff who care about making the patient experience a good one. I think it can be a little overwhelming sometimes to go to your doctor, especially if you have a lot on your mind. And so I think sometimes coming up with a list of things and bringing that to your doctor's appointment can help prepare you. In my opinion, the most important questions a patient should ask are, what preventative care should I do? Like, what cancer screenings should I do? What preventative labs should I do? What vaccinations I should do to help prevent disease as opposed to treat it once it already happens. I do have a lot of patients in Medicare. I would say, there's a big aging population in Northern Nevada, so that just naturally is a big part of primary care. I have a pretty large amount of seniors in my patient panel, and so it's important that we work with those patients to provide good care.
I am glad to hear Dr. Pinkston mention preventive care and nutrition. Eating well and exercising has been a huge part of my life, and Dr. Pinkston is here in town and available.
Not too far from Dr. Catherine Pinkston's office is Dr. Devang Desai, one of Reno's leading cardiologists.
He has been practicing in Northern Nevada for over 15 years and recently opened the Reno Heart Institute in South Reno. His unique approach to cardiovascular health has helped thousands of Nevadans.
Yeah, and I heard he's also accepting new patients.
Well, good, because he is our next pit stop on the road to good health. Doctor, this is a very nice office you have on Professional Circle. How often how much time do you spend here as opposed to the hospital?
So I think it's probably about 80-20. Most of the time being spent in the office, which is where we want to take care of our patients to try to keep you out of the hospital.
How much testing can you do here in your office?
So currently we offer exercise treadmill stress tests, which is where we're standing right now, EKGs, echocardiograms, blood pressures, vital measurements, and we're hoping to continue to expand that to really create a full one-stop destination for cardiac care.
I'm very curious in finding out, how does Northern Nevada rank when it comes to cardiology care?
I'm so proud to be part of this community, especially here in Reno and all of Northern Nevada. I think we've come a long ways as far as cardiac care goes. I think we have exceptional physicians and other providers. We also have exceptional hospitals. So I would rank us right up there with the best.
And you're thinking of expanding your office too, right?
That's the plan.
Okay. One more question. Please tell me, red wine and dark chocolate are still good for the heart?
I thought you might ask me something like that. So I'm gonna say within moderation. I think we can still keep those in the in list.
Just no more puffed rice cakes.
Exactly, and Twinkies.
Thank you so much.
Right.
Great talking with you.
Thank you. Healthcare is a journey, and as people go through this journey, they start with their primary care providers and they follow up, they keep their, hopefully, medical illnesses at bay. If they develop medical illnesses, they're diagnosed and they're treated. Sometimes the patient will need to be seen by specialists. I'm a cardiologist, and if you need something that's concerning for the heart, many times your primary care provider may refer us to a cardiologist or any other specialist. I'm very proud to have launched the Reno Heart Institute. At this point, nobody tells me how many patients I have to see every day. Nobody tells me what time I have to see patients. I get to make that decision, and I get to do what I think is best for my patients, like I would want my family to be taken care of. And secondly, being an independent cardiologist gives me the opportunity to work within all of the health systems in our area. And so I can work with all of the hospitals, I can work with all the different providers, and I think that's important for continuity of care with our patients. And so I don't want patients to come in and say, well, I can't see you anymore because I have to go to a different insurance plan, or I have to go to a different hospital that you're not part of. I want patients to be able to see me regardless of the changes in their life, and we want to be at least something that's stable in their healthcare. So just like healthcare is complex and ever changing, so are healthcare benefits. Patients ask me all the time, well, what insurance should I go for? What health benefits do I need? And my father a few years ago went on Medicare, and he realized there's hundreds, if not thousands, of options, and it can be quite overwhelming. Just like I told my dad, I said, you need to find somebody that can help you navigate through this complexity, because what's right for my father may not be right for anybody else. I strongly encourage my patients to find somebody that can help them find the plan that fits them, just like you find a doctor that helps with the treatment that fits you. So I'm fortunate to have gotten to know Health Benefit Associates, and I got to learn a lot about healthcare and the benefits associated with some of these plans. So, reach out to somebody like that. Reach out to somebody that can help you navigate this complex, but I think very fruitful relationship that you can form to find a plan that fits you and your needs. Unfortunately, heart disease is the #1 killer in America. Heart disease continues, even though we've made great strides in treatment, great strides in technology and medications, we still continue to deal with heart disease and the lives that it takes. It's affected my family. My father had a heart attack. He's doing great, but it definitely changed the way he thought about life, his diet, his exercise. Post-heart attack care is very important to long-term outcomes and also long-term recovery, because if you had a heart attack, your heart took a hit, for lack of a better term. And so it's very important to get on A, the correct medications, B, correct follow-up, and C, cardiac rehab. And I think cardiac rehab gets forgotten. And it's a very controlled environment where you get monitored, you get into an exercise program. It gives you a lot of benefits, one being more chance of full recovery and longevity. In fact, up to 50-60% benefit long-term for outcomes.
From the sounds of it, Dr. Devane Desai will be staying busy at his new practice, working both there and in the new hospital in South Reno.
The new hospital looks unbelievable. I took a tour on opening day, and I'm very proud we have this new facility, South Reno's Sierra Medical Center. This hospital provides care from leading doctors in the area and is equipped with state-of-the-art emergency services, diagnostic imaging, and private rooms for all patients.
That's right, and technology has been integrated in every part of the hospital, and it is no surprise why everyone is talking about it around town. Okay, our next guests on our tour of healthcare are Dr. Travis Anderson and Dr. Letitia Anderson.
Isn't Dr. Letitia Anderson the chief of staff at the new hospital?
She is, and her office is a hop, skip, and a jump away from Dr. Desai. So let's continue our journey to the new Sierra Medical Center to see how the hospital will change healthcare in Nevada for years to come.
The opening of Sierra Medical Center was a very exciting time for all of us. The years of planning up into the few weeks of really trying to make sure everything was there to care for any type of patient that walked in that door that first day. So the prep made that excitement the first day ecstatic. I think a lot of us thought it would be a slow opening, but once we saw our first patient, we saw 30 more right off the bat. So we became a highly functioning, fast, busy emergency department right away. And I think our healthcare partners with REMSA were able to provide transport for a lot of patients there, be able to check out the facility and get that definitive care within the region. So that first day was extremely exciting, but quickly turned into a work day with how busy it was. We had some very ill patients that day. We had a great case where a patient came in with a very dangerous stroke, and we were able to treat them extremely quickly and get them out and into that definitive care. And I did receive word a few weeks later, fully back to normal, doing great out back home with his wife. So Sierra Medical Center greatly expands our ability to care for patients, especially definitively, meaning getting them to the specialty services that they might need. We have every specialty service that you could want in a hospital, so any type of care from a pediatric patient to a neurosurgical older adult, we can take care of and get to the right specialty. And it also offers a lot more beds within the community, so we can offset any overburdening from other hospitals and be able to care for all the patients that walk in the door. So the Sierra Medical Center was designed to turn every single room into an ICU bed. And the theory was not so much that we need that many ICU beds, but it was that so the patient wouldn't have to move, and that if we do need to expand capacity, we can do so immediately. I think the pandemic of COVID really reaffirmed those decisions and made sure that we did that, because at the time we may have needed dozens, if not hundreds more ICU beds to be able to take care of those patients. And in our hospital, if someone gets more critically ill, we just change the class of the room, provide some more nursing services, and the patient doesn't have to move or change anything at all. We're very lucky at our emergency departments within the Northern Nevada Health System to have a lot of support by Universal Health Services to have the top-notch, highest tech that you can have in an emergency department, from bedside ultrasound to assess patients quickly, to high-tech imaging, the best CT, MRI, and X-ray imaging that you can get, a fast, high-potent lab that can take lab work and assess really any condition you have, as well as our ancillary services in the operating room that have all the tools they need to handle any sort of condition. And procedure-wise, we can handle all of the things from GI to our ICU patients. They all have really high-level technology and expensive equipment that can take care of any condition that walks in through our doors. We are a comprehensive care center in and itself. We can take care, assess, and evaluate and stabilize any type of patient. From there, if you need a certain type of specialty service, not all of our hospitals have every service, but we have the ability, especially with Sierra Medical Center, to get you to the right place. And if we do need care even out of state, we're able to arrange those transports for very rare type cases. But in general, this community can handle nearly every type of patient condition that walks through the door, whether they're established with our system or having a new chest pain type system. It's one of the top complaints in the emergency department, and we're equipped to handle just about every type of complaint. For our emergency departments, we are STEMI ready for any patient coming in with chest pain complaints, from having a major heart attack all the way to having a mild cold. So we are ready to assess them within minutes, move them on to a cardiology suite where they might need definitive treatment with a cath lab or procedure, or be admitted to our hospital. In our emergency departments, we're always working to see patients as fast as possible, but also taking the time to provide appropriate care and that kind of compassion that we like to give all of our patients. That does take time, but we are designed to see patients and assess them extremely quickly to see how sick or ill they are, and then prioritize those patients and bring them back to rooms based on their acuity or how ill they are. And all of our departments are designed to bump up staffing and increase our throughput, or how fast a patient gets through the department, based on those changes in volumes. Sometimes there might be a small wait, but for the most part, in most of our emergency departments, there is very little to no wait when you come in the door. For our senior population, we are currently working on a geriatric accreditation where we specialize in older individual care, which means using our primary care physicians, our hospitalists, and other specialty care services to get everything that an older individual might need. So our emergency departments handle and take any type of insurance. In fact, we don't ask for insurance until you've been treated and stabilized. So any type of insurance, from Medicare to private insurance, we will bill your insurance. However, we don't take that into measure until you're safe and we've taken care of you and you're stabilized. So it's a joke in emergency medicine that we should probably be sponsored by a sneaker company because we're always on our feet and moving fast and run through sneakers very often. So in the emergency department, we're streamlined to take care of the most sick and ill patients first and also be able to take care of all of our other patients. And that includes multiple staff members from ancillary services, from imaging to lab work to pharmacy, so we can take care of many patients all at once and move them through as quickly as we possibly can, but most importantly, as safely as possibly can. So Sierra Medical Center is open, it's fully functioning. Emergency department services, all of our surgical lines, all of our inpatient services are ready to go. When you drive by, you may see a little bit of construction, but that's for our medical office buildings, which provide further outpatient care. However, everything is running, there's plenty of parking. Our emergency services know exactly where we are. The emergency department and the main hospital are very easy to navigate. So if you need any sort of care, we are there 24/7, all day, all night.
We really appreciate in this community the startup of this new hospital, which is the first full-service hospital in more than 100 years in the Reno area. We appreciate that opening. Opened on the 1st of April, roundabouts, and it's slowly up-ramping. So it's really amazing to watch and amazing for business to peak up. We've been waiting for this in our community for some time now. When the hospital was in its very, very inception, 10, 15 years ago, the thought was clear. This region is growing exponentially. Northern Nevada is one of the fastest growing regions in this country. And with all of the other changes happening, it was very difficult to be forward thinking in the building of hospitals and building primary access sites for patients. So that was the primary goal. The mission in and of itself was to continue to celebrate life's journey and to continue to bring things forward to keep patients going on. You know, there's a beautiful billboard that we have that shows someone, you know, looking out at a mountain, and you drive past it and say, and then you realize that's exactly what we're talking about. You don't want to be stuck with me in the emergency room. I like seeing you, but I'm sure that's not what you want. You want to be out there avoiding emergencies, enjoying who you are and who you live with. That's life's journey, you know, so that's the mission. And I believe that all of us have our boots on the ground when it comes to that. You know, with the hospital opening, I don't think anyone has wavered from that mission. And you walk in the door, I think you feel that. You feel that this is a place that's beautiful, and there's lots of room and lots of peace to be found there with that in mind. And Sierra Medical Center is very different. Myself being a provider who's worked full-time at different hospitals, all of the hospitals here in town for 15 years, I can tell you these patient rooms are the largest by space and the most private anywhere in town, for sure. For an oncology patient suffering from cancer and going through steps from their diagnosis to their treatment and their recovery and remission, it's key to have a seamless journey for them. Cancer care specialists are the largest group in the area. Their physicians are right nearby. So no matter what treatment they're getting, either now or in the next years, the seamless treatment between Sierra Medical Center and cancer care specialists will be there. What we're doing from Sierra and from Northern Nevada Medical Center groups is starting freestanding emergency rooms that'll help support and unburden big hospitals from unneeded, admissions or visits that might be able to be held that way. Also, the medical centers, I think, will perform lots of access for different service lines that are very needed in our community. To name a few, obstetrics and gynecology, orthopedics, like I mentioned before, oncology, and of course, cardiology. Cardiovascular services are something that has been very sought after in this region. It's something that I've lived and breathed for the last 15 years, and I'm very passionate about improving access for. For our patients, that means advanced services, not only nuclear imaging, echo imaging, vascular imaging, but also interventional procedures and open heart surgeries. As some of you might know, these days these things are more and more becoming less invasive. So often we're not using open heart, but we're using things such as transaortic valve replacements or mitral clips to help people suffering from advanced valve disease. A lot of our services are relying too on state and federal permits to get these things put through. And we believe strongly that these things have to be in place. Open heart is awaiting in July, which is now, we're awaiting our permits to start open hearts within the next few weeks. That should be a wonderful thing, and we have patients already waiting for these services. So robotic surgery nowadays in this region is very important. Many different types of surgeries, including orthopedics, general surgery, and open heart use robotics. Sierra opened with a beautiful hybrid room that is capable not only of doing interventional cardiology and interventional radiology and vascular surgery, but also open heart. The open heart room is up and ready to go, and we're planning our first open hearts within the next month or so. So we're looking forward to that, and many of the surgeons coming to Sierra Medical Center that we're contracting with are highly trained and open and ready to use robotics. Excellent advice to give to Medicare patients, particularly more mature or older patients, is make sure you have a primary care doctor. Make sure you have access to this person. Make sure you know how to contact them and keep in touch with them. Prevention is so much easier and so much more affordable than dealing with emergencies, that's for sure. For all of our Medicare population, it's very important not only to get primary care and preventative care, but also get your annual screens, make sure you keep on top of your routine preventative health care. It's so important for preventing further complications or further admissions and things that are definitely unwanted and emergent. Yes, I've worked with health benefits associates before. Their professionalism and niche in regards to personal touch in this community is very well needed. And if you want to ask me about education, boy, the more education I can get for my patients and my friends and my family and perhaps even my colleagues, the better. Everything we learn is built upon education for our patients. It helps lead us to wellness and prevention.
The new Sierra Medical Center sounds unbelievable, and I think it's sorely needed here in Northern Nevada.
This virtual tour is only a glimpse of all the new advancements and specialties we have coming to our area. I can't wait to see what else they do for our community.
Oh, me too. And if you would like to learn more about topics surrounding healthcare and newly expected medical facilities, please visit us online at healthbenefits.net.
There, you can contact us with any questions or feedback. Our team is here to help you find the Medicare plan that covers the top doctors here in Northern Nevada. I'm Alex Sampson on behalf of Health Benefits Associates. We want to thank all of the passionate healthcare workers here in Northern Nevada.
I'm John Potter, and we will see you next time.